Guys, this is Mobeen. We are talking about cardiovascular system general principles. Let's continue and now discuss what will happen when various changes occur in the lung, in the factors that are controlling the lungs. Before we go there, I want to do one more thing, one more difference from systemic circulation, and that is the pulmonary capillaries diameter and the control of that. So let me make a little diagram here. What happens is, let's say this is the pulmonary artery bringing the deoxygenated blood in. Then we have, let's make a green colored capillary here. This is a pulmonary capillary. And then let's make an artery here. So the blood comes in, flows through the capillary, and then goes out. On the capillary is present the alveolus, right? This is the alveolus. Now, this is a second difference from the systemic circulation, and this is where they ask you many questions here. What happens is that based on the oxygen content of the alveoli, or based on the oxygen content of this area, the capillary diameter will be controlled. So, normal systemic behavior is that hypoxia will dilate the blood vessels to increase the flow of the blood to a particular area which is experiencing hypoxia, which is experiencing less oxygen. In the lungs, it is the reverse. If the oxygen level is low in some part of the lung, then the capillary in that area becomes constricted and shuts down. Do you think it's a good thing? Have you read the dead spaces yet? What do you think? Is it good or bad? Look, it is good. Why it is good is, if this alveolus is not functioning, somehow the blood, it doesn't have oxygen, maybe the alveoli, the bronchiole here is collapsed, maybe there is a mucus plug stuck here, maybe there is some infection here, maybe there is some foreign particle that came in and got stuck somewhere up here. The end result is that the alveolus does not have oxygen. If the alveolus does not have oxygen, if there is no oxygen, do you think that bringing blood to this alveolus is useful? No. This blood is going to do nothing. It's not going to do gaseous exchange. This door is closed. So it is smart of the pulmonary vasculature to say, all right, there is going to be no gaseous exchange here. I'm going to shut down this channel. I'm not going to bring blood here. That is why the hypoxia causes the pulmonary capillaries to constrict, while hypoxia in the systemic capillaries causes them to dilate. That is and of course the vice versa. So that is another big difference in the pulmonary circulation compared to the systemic circulation. All right, let's continue discussing what would happen. So let's look at some factors. Let's say what happens when we are exercising. Exercise. I'll go through this table. This table has 12 columns. What are the columns here? Pleural pressure. What happens to the pleural pressure? What happens to the vessel compression? Pulmonary vessel compression. What happens to the venous return? Right heart return, which will be the inferior and superior vena cava bringing blood to the right heart or to the left heart. That is the pulmonary vein bringing blood back to the left heart. What happens to the cardiac output, blood volume? What happens to the resistance of the pulmonary vasculature? What happens to the flow of blood through the pulmonary vasculature? What is the pulmonary vascular pressure? What is the systemic blood pressure? And what happens to the heart rate? So let's look at it. Exercise. I'm going to draw the diagram over here. For this, what we'll do is we'll have a conceptual diagram. The conceptual diagram is this. Let's say this is thorax or thoracic cavity. This is body. In this thoracic cavity, we've gotten the right heart. This is the right heart, right atrium and right ventricle. This brings blood to lungs. Lungs give blood back to the left heart. So right atrium, right ventricle, lungs, left atrium, left ventricle. From the left ventricle, the blood, so the red one are oxygenated bloods. Blood goes out to the body. This is body. From here, the venous blood, after the capillaries have been encountered, venous blood would go back to the, I'll make it this way. Okay, cool. So the venous blood goes back to the right. So this is the channel. This is the series circuit. During the exercise, what happens? Couple of things. Number one, cardiac force of contraction increases. Cardiac rate would increase as well, heart rate. So that would increase the cardiac output. So one thing we'll say here, the cardiac output will increase a lot. Why? Multiple factors. One of the factors is force of contraction of the heart is increased. Second factor is heart rate is increased. Third factor is venous return has increased. Why? Because the muscles are contracting. Muscles, when they contract, they act like pumps and they circulate the blood back towards the heart. So the venous return has increased. Now, what will happen? Let's look at it. When the output has increased, cardiac output, that would increase the venous return on the right side. Venous return, don't say blindly that the venous return on both sides have increased. On the right side, the venous return has increased. That will mean that the blood flow to the lungs, increase blood volume to the lungs, right? So I'll say blood volume to the lungs have also increased. That also means right heart venous return has also increased. However, because the pulmonary circuit is a compliant circuit, it's a passive circuit, as the blood comes into the pulmonary vessels and it is more blood, what would happen is that the pulmonary vessels would dilate. That means what would happen to the resistance? It would reduce. If it was systemic tissue and systemic vessels, then the vessels would try to maintain the lumen and they would try to constrict. Here they are increasing, so resistance will go down. Resistance would go down. What would that do? If the resistance reduces, that would cause the flow to be increased. Some pressure would increase, not too much, but some pressure would increase. So the end result is, if the resistance has increased, if the vessel has become dilated, plus there will be recruitment, what will happen to the pressure within the pulmonary system? Too much increased or not? So this is what is important. This pressure is not going to be too much increased. That is really important to keep in mind. Large changes in cardiac output do not incite large changes in pulmonary pressure because of the compliance of the pulmonary system, because of the distensibility and recruitment of the pulmonary vasculature. Okay, cool. Now let's talk about inspiration. Actually, before that, let's talk about hemorrhage. What happens during the hemorrhage? In the hemorrhage, the first thing that happens is blood volumes reduce, right? So blood volume has reduced. So let's go to the hemorrhage. Same diagram again. What will happen? This is lungs. This is right heart. This is left heart. This is thoracic cavity. This is body, right? So the first thing, venous return to the right heart, venous return has reduced. So I'll go over here and I'll say right heart venous return is reduced. That will mean the flow to the lungs will reduce. So the blood volume going towards the lungs is also low. Now here is the magic. When the blood volume to the lungs is low, that would increase the resistance. Because it is the reverse of the body, the systemic tissue. Increased resistance, this is important. Increased resistance would increase pressure. So the pressure, I would just say, is slightly increased. not too much. Once again, hemorrhage is causing pressure loss in the rest of the body, but pulmonary pressure is still being maintained. Why are we maintaining it? Because we want to have the gaseous exchange to continue as reliably as possible and as long as possible, even when a person is hemorrhaging. So the pressure in the pulmonary system is still not down. The volume will go down because the resistance has increased. So that reservoir, if you come here, this 500 milliliter, because of the increased resistance, that means because of the constriction of the pulmonary vessels, some of this 500 milliliter will be donated to the body to try to compensate for the hemorrhage. So that is an important aspect to keep in mind. Okay, so we're talking about the inspiration. This is something that really bothers some of the students, and this is something that they really ask in the USMLEs. And it is really important to understand, because when a patient comes to you and in certain conditions, you are going to put the stat on their chest and ask them to inspire or expire their breath, and you're going to see what happens to the heart rate and sometimes even blood pressure. So let's look at it. It's very logical. It's very simple. Just keep in mind how this circle starts. Inspiration. Look at this diagram. What happens? Thorax expands. When the thorax expands, pleura expands. What will happen to the pleural pressure? It will become negative. So pleural pressure would go down. When the pleural pressure goes down, then what will happen is the vessel compression would reduce, or you can say vessels would get distended, because pleural pressure going down means it pulls the lungs out. So vessels will become distended, and the shutdown or collapsed vessels will become open. So that is recruitment. So vessel compression will become negative. Now what happens? The blood will be sucked in to the thoracic cavity from the body. So that is inferior vena cava and superior vena cava. Blood will be pulled in. So venous return on the right side will increase. That means, so the venous return to the right side has increased. This is the right heart, this is the lungs, this is the left heart, this is thorax, this is body. So what is happening? The venous return to the right heart has increased. Increased venous return. That will mean there will be more blood flowing towards the lungs, right? But think about it. Here is a trick now. Lungs are expanded. Lungs vasculature is expanded too. So the blood that moved to the lungs, will it come out? No, it's going to go and tend to stay there. So what will happen to the blood volume inside the lungs would increase. That also means that that extra volume is not going to come back into the left heart. Why? Because the volume is sitting in the lungs. Why? Because the lungs are expanded. Okay. So what would happen to the venous return to the left side? This is where students get confused. Normally when the books say, or the teachers say, venous return increases, they assume venous return increases on both sides. That's not the case. Venous return on the right side increases. This is the right side. On the left side, the venous return is from the lungs, and lungs have become expanded and their reservoir or capacity has increased. So the venous return to the left side actually reduces. So venous return on the right side increases, but the venous return on the left side reduces. When the venous return on the left side would reduce, what would happen to the left side's output? That would go down. So the cardiac output on the left side will go down, not on both sides. Right side output is increased. Left side output is reduced because the input is reduced, because the blood is sitting in the lungs. Now what would happen to the blood pressure? Systemic blood pressure. It will reduce. Systemic blood pressure will reduce. Now when the blood pressure reduces, what do we do? What is the reaction? We'll do that in our future lectures, that when the blood pressure goes down, there is a reflex activity through which the heart increases the heart rate and force of contraction. So I would just say here, heart rate would increase. That is to compensate for dropping blood pressure. We'll talk about that. We haven't done that yet. So inspiration reduces the pleural pressure. That sucks the blood in. So right side becomes has more volume. Lungs get more volume. Lungs expand and become a reservoir, so they give less blood to the left heart. Left heart has less volume. Cardiac output of the left heart is reduced. Blood pressure is reduced. Reflex tachycardia will occur. So that's that. Now let's see what happens with the expiration. Reverse of this. It's simple. Expiration. As I expire the breath, the chest cavity is collapsing. Compression is occurring. Pleural pressure has become positive. So pleural pressure goes up. Due to this compression, what would happen is that do you think the blood would come in when there is pressure on the chest cavity from the body? No, it will not. So the venous return on the right side will reduce. When the venous return to the right side would reduce, what would happen to the right cardiac output? Or right side output to the lungs? That would also reduce. What would happen then to the lungs? Should they give more blood to the heart, left heart, or less? They give more blood to the left heart. Do you know why? Because chest is compressing and lungs are a reservoir. We established that lungs usually contain 500 milliliter extra blood sitting in them, in the vasculature. Now, when the lungs is being pressed, that extra blood, little bit of that, depending upon how much of the compression is there, that blood comes out and goes to the left heart. So left heart venous return in expiration increases. That would cause left heart cardiac output to increase. That would cause blood pressure, systemic blood pressure to increase. And reflex bradycardia. Whenever this systemic blood pressure goes up, the whole body tries to adjust. The way heart tries to adjust is that it slows itself down, plus it pumps with lesser pressure, lesser force. So the heart rate would go down. Now, if I do and stay like this, would this happen forever? No. At some point, this will become equilibrium again. So either if I keep holding my breath, I'll die, or this equilibrium would be established. So it is not that lungs have unlimited amount of volume capacity to receive or to give. This is when you ask a person to expire and you're listening or you're monitoring the blood pressure, this is what's happening. Now let's talk about Valsalva's maneuver. Very, very Valsalva's maneuver. So this maneuver is very simple. What you do is you ask the person to close his nose and close his mouth and then forcefully expire against that, like this. Normally it is used for many things. It is used to check the autonomic nervous system's health. It is used to open up the sinuses. It is used to open up the middle ear or the eardrums, or it try to check the eustachian tubes. It is also used to test the cardiac reflexivity towards the changing pressure in the thorax. So many uses. But look at this. This is an extreme pressure. So what is happening is vessel compression would come into play as well. The rest of all, if this is like expiration. So first of all, pleural pressure extremely positive. That would also cause extreme vessel compression. So keep an eye on this one. Extreme vessel compression in the beginning would give a lots of blood back to the left heart, but then there is no more blood coming in. So first blood pressure should go up, then blood pressure should go down. First cardiac output should go up, then the cardiac output should go down. And if there is reflex heart rate increase or reflex heart rate or tachycardia, first with the blood pressure up, there should be reflex bradycardia. Then with the heart rate low, there should be reflex tachycardia. So this one is interesting because you have to say first this, then this. So here, Valsalva's maneuver, pleural pressure increases, vessel compression occurs, venous return to the right side goes down because we have really caused increased pressure in the chest, so blood cannot come in from the body. Venous return to the left heart will increase. Why? Because we are compressing the lungs. However, this is first it will increase, then at some point the lungs have squeezed the blood out and there is no more to give out. So then the venous return to the left heart would reduce because even the input to the right heart is also reduced. So blood to the thorax is less. So first this, then this. First increased, then reduced. Then what would happen to the cardiac output? That is the left heart output. First increase, then decrease. First, then. You have to do it. Blood volume, similar thing. Forget about resistance and other. Let's look at the blood pressure. What happens to the blood pressure when the cardiac output has increased? Increased blood pressure. When the blood pressure increases, what happens to the heart rate? Reflex tachycardia. If the reflexes are normal, reflex bradycardia. So first increased blood pressure and reduced heart rate. Then as the venous return to the right heart is gone, the lungs have squeezed the blood out. Overall input of the blood to the heart is less. Cardiac output would reduce. Blood pressure would reduce. That would cause tachycardia, reflex tachycardia. And that is what happens in Valsalva's maneuver. Final topic for the day, which is an interesting topic, and that is the difference, the pulmonary wedge pressure. So look, what happens is that sometimes you need to measure what is the pressure on the left ventricle side. Right ventricle, you can send a catheter through the superior inferior vena cava, most superior vena cava, jugulars, and you can actually measure it. Left ventricular measurement is difficult. There is no direct path to the left ventricle. So to measure the arterial atrial pressure, left atrial pressure, then to see what is the pressure gradient, which is important in some pathologies, what we do is we use Swan-Ganz catheter, or we use pulmonary wedge pressure. So what is that wedge pressure? Let's just very quickly look at that and we are done. So here it is. Let's say this is superior vena cava. This is inferior vena cava. This is right heart. This is right ventricle. This is the pulmonary artery. And you know that pulmonary artery would start dividing till it reaches the arterioles. Then it reaches the state of capillaries. Then it would become venules. These venules, I should make them red because they have oxygenated blood. These venules would then collect. This is the capillary end of the vein. Then these are the venules. The venules would collect and make bigger veins. That would finally make pulmonary vein and go back to the left heart. Now, check this out. What we do is we insert a Swan-Ganz catheter into the right heart. There is no access to the left atrium. From the right heart to the right atria, to the right ventricle, from there to the pulmonary artery, and from there's a small balloon attached to it. We keep pushing it into the pulmonary artery till it gets lodged into the smallest possible artery it can get stuck at. Now what happens is when it gets stuck there, the blood supply to that area gets occluded after that. So that means the blood pressure now, the exerted pressure on it is almost the same as it was on the other side. So this pressure measurement from here, from this balloon, once the balloon has gotten lodged, the pressure measurement at this end is called the pulmonary wedge pressure, because we've wedged a balloon there. This is taken as almost equal to the left atrial pressure, and that means whenever you're trying to figure out, pressure gradient across the lungs, or whenever you need the left atrial pressure, this is what you'll be doing. So thank you very much.